Good evening, everyone, and welcome to the Institute of Interpersonal Hypnotherapy with me, Matthew Brownstein, streaming online now on YouTube, Facebook, and LinkedIn, or perhaps you're watching this as a recording. Thank you for being here. I am very interested in the work that we do here because it truly helps people. And therefore, tonight's topic is interpersonal hypnotherapy for healthcare workers. We've been running the Institute of Interpersonal Hypnotherapy now since 2007. It was originally the Florida Institute of Hypnotherapy. And I would say about 5 years into our trainings, where I don't know how many people are going through at the time, but it's been a significant number now for sure. We did a survey to see how many people were actually in the caregiving professions who had attended the school. And how many do we see now? It's over 50% that already are in one of the caregiving professions. So you don't need prior degrees to be a hypnotherapist. You don't have to be in any of the other caregiving professions. You don't have to be a licensed practitioner. Therefore, this talk is for everyone. If you're in a caregiving profession and you're thinking to any degree that hypnotherapy or using hypnosis could help your clients or patients, it absolutely can. And I'll give an in-depth presentation tonight about that, covering a lot of the different healthcare fields. But if you're not in those, you can still utilize hypnotherapy in non-therapeutic ways and working with medical professionals in therapeutic ways. So you might be a physician and saying, well, I'm not going to quit my day job, but I would like to be able to refer my patients to a hypnotherapist. Or a hypnotherapist might say, never really thought about actually teaming up with physicians. We have graduates who work with physicians and psychiatrists who've worked out of chiropractic clinics and acupuncture clinics. And I'll go on about all the different professions tonight, but definitely understand that in any way that you feel called to this, you can help people by utilizing the power of the mind. So that's tonight's topic. Let me give you a very brief introduction to us. We are Anahat Education Group is our primary corporation that houses the Institute of Interpersonal Hypnotherapy, but also the Interpersonal NLP Society, our national or international association for credentialing and regulation of interpersonal hypnotherapy, Silent Light Publishers, and one of my main projects, onlinemonastery.com. Here we have support groups that occur every Tuesday night, at least through June. We'll see if we keep those going. Maybe it'll become once a month. But if you're interested in some very deep, very powerful meditation, check out onlinemonastery.com or join us for the support groups as well. Okay, also, just to get us started, our next state licensed hypnotherapy training begins June 29th, 2022, and you can learn more at instituteofhypnotherapy.com. Okay, so that's it into tonight's topic, interpersonal hypnotherapy for healthcare workers. So let's just go to the next slide. Let's start with what is interpersonal hypnotherapy. Is it just hypnosis? Is it just hypnotherapy? It utilizes both of those words, but it goes a lot deeper. It's important to understand that the standards in this profession have been relatively low, right? There's no national certifying board, there's minimal laws, there's minimal regulation, and pretty much anybody, licensed or not, certified or not, regulated or not, can call themselves a hypnotist, because you can go be a stage hypnotist. You can go read a book on hypnosis and start working at a senior center and hypnotize them to help them to relax or to be more optimistic or find more inner peace, right? You can always help somebody to alter their mind a bit, to relax, to be more receptive, and to take positive suggestions. That really doesn't need regulation. When we start using the term hypnotherapist, then often we are implying some clinical application. Clinical hypnotherapists often are trained to some degree in working on medical conditions, themes about healing the mind to heal the body, topics like psychoneuroimmunology, big fancy word for a field of study that actually looks at how the mind-brain-body connection works and why certain guided imagery techniques actually can be proven to affect the physical body. Dr. R. Jana was quoted as saying, over 30 years of research, his work has proven that every single autonomic nervous function in the body can be influenced through properly worded suggestions. So basic suggestion therapy is kind of in the realm of hypnotist. As you get more into hypnotherapists, now you're dealing with more powerful transformational modalities with ideally a lot more training. Right? Somebody might get a weekend. We can talk tonight about for a social worker, mental health counselor, psychologist. Usually you only need an additional 40 or 50 hours of pretty basic training to get to say under your licensing boards that you are practicing hypnosis. A lot of those people, psychologists, mental health counselors, social workers, and others in that field, PsyDs, they go through our school because we offer over 500 hours of training, and we're very close right now in September. We should be, as long as everything goes smooth, licensed by the Department of Education to be offering 750 hours of training. So there's a big difference, right, between 40 hours of training, a weekend workshop, 2-weekend workshop, or 100 hours versus 750. So what is interpersonal hypnotherapy beyond just high standard state licensure? It's an in-depth way of working with the mind that is based largely in mind, but also a lot of our teachers who have contributed to our curriculum. Based in my background, my original background is as a philosopher. That's what my degree is in, philosophy of religion and religious studies. But then, what do you do with that? Even though I could have gone into academia. So I do consider myself, a philosopher. However, learning how to think made me say, well, how do you truly, truly, truly help people? But that led me to Chinese medicine. So I've been to 2 different Chinese medical colleges because I wanted to use the knowledge and wisdom I had to be able to help people to heal. I wasn't quite disheartened with Chinese medicine. I would just say it wasn't what I was looking for. It wasn't getting to the depth of how I wanted to help someone. Then during acupuncture college, I started studying hypnotherapy and neurolinguistic programming and breath work and other related techniques, and started understanding more about not only anatomy, physiology from the Western or more physical perspective. I was studying the energetic anatomy, but also just the psychology of what's going on underneath. So I don't really attribute to myself any one specific occupational title, because I've just spent a lifetime studying this and developing a system of mind-body healing, essentially, that's being applied all around the world now. So if I can humbly say so myself, I really work to be a pioneer in very high hypnotherapy standards, but also an understanding of hypnotherapy that relates to this word interpersonal. Simply, the interpersonal component is not just about people, because all transformational work, facilitation work is in between people. Interpersonal hypnotherapy involves looking at what's happening in the subconscious mind through an interpersonal filter. You could use the word intrapersonal because we're looking inwards. Inside the subconscious mind, we don't just have a lot of negative memories and negative beliefs and negative emotions, which lead to negative behavioral outputs or psychosomatic illness. We have inside the subconscious mind relationships, your inner child with your inner parent predominantly, but the person who hurt you in a memory, you have these dynamics. Knowing how to resolve those dynamics is crucial, because if not, you could just be treating symptoms. So to move into tonight's topic, imagine if someone has a headache. I'm going to put my hand up here. All right, but then if you kind of watch where the hand goes, below that can be a major layer of tension in the neck, throat, shoulder region, right? We're all locked up inside. People are still, to this day, it's amazing, suppressing their emotions. I mean, it's such a common thing. But for me, I learned in my early 20s, that's really not a good idea. Don't block your emotions. Don't close your chakras. Don't lock up so much that all you do is live in your head and not in your heart. And you can't have access to your feelings. And all you are is a miserable intellect, right? Like, what happened to the love? What happened to the joy? What happened to the bliss and the passion, the creativity and the wisdom? Well, it's all buried underneath the underlying hurt. So the headache, underneath all this tension, like let's say it is really just psychosomatic for this type of pain in the head. Below that, we do have this layer of tension. We tend to have a lot of anxiety and depression at this layer. We're going to talk about that next week, this model in relationship to anxiety and depression. The anxiety tends to be you have emotions trying to come up, but you're pushing them down. Depression tends to be emotions trying to come up, but you're pushing it down. So why do you get anxious? Because you're afraid of what's in there. And why do you get depressed? Because you're blocking what's in there. Now, what's in there underneath that layer of suppression, this block, this wall, this body armoring, this attempt to not fully feel? What's underneath that tends to be anger, is like one of the most surface layers. So let's say the anger is in there, and the anger is actually what's predominantly contributing to the headache. If all you do is treat the headache, you're only treating a symptom. If all you do is treat anxiety and depression, you're actually only treating a symptom. Because what's going on in the heart of a human being, not just a chemical imbalance, emotions. Underneath the anger is fear. And underneath the fear is hurt and sadness. How do we know that? Because when a child gets hurt, that child becomes sad about the hurt, right? That hurt, and that made me sad. I'm going to cry. But then I start getting scared of that which is hurting me. And then if I can't get rid of that which is hurting me, which could very well be my own parents, then I start getting angry. But what do you do with the anger you have towards your parents? You usually end up having to suppress it. And that emotion is actually called guilt. So what's underneath this headache and a layer of often suppression and some level of anxiety and depression? Hurt, sadness, anger, and fear. What's inside of that? Negative belief systems that we, and it's that inner child level, right, the subconscious itself, we're holding beliefs like I'm bad, I'm stupid, I'm not good enough, I'm useless, I'm not deserving. All of that is going on inside of a human being. That's a person, right? But that person does not exist in isolation. That person is in relationship with others, not just externally, but internally, right? Your inner child is scared of your parents and is reliving that over and over again. Now, this dynamic that most people live with is affecting our physiology. It's causing things like ulcerative colitis and stomach ulcers and Crohn's disease. It can cause all sorts of imbalances, right? I can't go through the whole list, but just imagine how much illness is psychosomatic. Well, all of that is what I'm talking about, right? And more illness can be seen as psychosomatic, or just negative behaviors like too much drinking or smoking, right? Your body isn't forcing you to put toxins in it, but these negative emotions tend to push us towards finding something that makes us feel better. So even though you might say, well, smoking isn't psychosomatic illness, if you end up getting cancer from that, well, it kind of is, because the cigarettes didn't jump in your body, right? Your emotions motivated all that healthy behavior. So this will affect our energy body. If you're in energy medicine, if you're a Reiki practitioner, if you're an acupuncturist, or any other field that's dealing with energy, what is this energy that's out of balance? Emotion, energy in motion. But what happens when we stop that emotion by suppressing? We create blockages. In Chinese medicine, we're working with acupuncture to move the flow of qi in the meridians. Well, why is it getting blocked in the first place? Because people suppress and block their emotions. We'll talk tonight about these different fields. In chiropractic, for instance, a chiropractor will work to get your spine back in alignment. But why is it getting out of alignment in the first place? Now, there are physical things that happen, right? Car accidents, and there's environmental toxins. But a major component of illness in Chinese medicine is actually unresolved emotion. Anger affects the liver. Sadness affects the lungs. Anxiety affects the heart. Fear affects the kidneys. Spleen, stomach, pancreas system is affected by too much rumination or worrying, right? So your emotions absolutely affect your physiology. But in Chinese medicine, we're looking at the energy body as well. So if you've got this headache, what are you actually treating? If you treat the headache, but it's from psychosomatic origins, you're not really helping all that much except you're relieving pain. But you can be doing a disservice in some way, because if you don't hear the whispers, you have to hear the shouts. If a person doesn't resolve the root cause of their problem, but only masks it through medications, for instance, then, or whatever technique we use to eliminate the pain, if the root cause is still there, it's going to find another way to manifest. If it's not allowed to do it with the head, maybe it does it with the heart or the stomach. These symptoms that we have are ways that our body is saying something's wrong. But if you only get rid of the communication, just get rid of the message, then you're in many ways doing a person a disservice. So it doesn't mean that doctors stop being doctors and nurses stop being nurses. Everybody has their place, and thank God we have doctors and nurses. However, you can only work within the modalities that you're trained in, and you can only refer to people who you know are in your wheelhouse, like you know who to refer to. But what if you don't know to refer to a clinical hypnotherapist, or more specifically an interpersonal hypnotherapist? So that's a brief overview to interpersonal hypnotherapy, is that it honors the being inside of us, and it works directly with that being. Now, what's the major thing going on with that being, that subconscious inner child who's hurt and sad and scared and angry and feeling guilty and filled with negative emotions and is in conflict with him or herself and in conflict with others, right? That's just how most humans live, and it causes significant illness. The real root cause of all of this is unforgiveness. So after years and years of study and many, many, many years of practice, now I've been in this field for like 30 years, I can say that at the root of that headache is an unforgiveness, that something's going on in the heart that needs forgiveness. Now, we have to understand what that word means, but I'm just acknowledging what is interpersonal hypnotherapy. It's not just a fancy title. It's really a unique way of working that gets to the root cause of the problem and does it with the idea of miracle-mindedness, meaning once we apply true forgiveness, that whole card house I've been describing drops away, and symptoms drop away, but root cause drops away. And if we don't have forgiveness somewhere in that equation, we are missing something. Anyway, let's go into some of the other professions. For years, I gave lectures called Healing the Mind, Healing the Body. Now, we do in our profession of hypnotherapy have to be careful of using the word healing. In some states, that's relegated only to licensed practitioners of the healing arts. Yet I do come from a place where I use that term in much more spiritual terms, like as a spiritual healer or a metaphysical healer. But again, I'm giving a slight disclaimer, especially for our students, to be careful of using that word depending on your credentials. However, for years, I gave the lecture called Healing the Mind, Healing the Body. I spoke about my background in Chinese medicine, hypnotherapy, neurolinguistic programming, breath work, and mostly I just talked about the mind-body connection and why a change in the mind can affect the body, and well, just a lot, about that topic. People were literally walking out of those lectures healed at times because they would hear what I was saying and they were like, wow, my mind is causing this. I don't have to do that anymore. I had people like throwing away their crutches, literally, walking out of some of these lectures where they started realizing you can heal right now. So I became very passionate about the mind-body connection, and it's a major part of our school. One of my books, this is the new cover I'm really proud to show, The Sutras on Healing and Enlightenment, a spiritually based approach to mind-body healing. This cover isn't online yet in Amazon, but just to let people know, I've done a lot of work in this field. This is a 400-page book, and it relates to the healings that I was performing when I was living in India in the Himalayas. And I started realizing, this was back in about 2003 or something, I started realizing, I think I know what I'm doing. I think a lifetime dedicated to how to heal the mind, to heal the body is starting to pay off because I'm seeing these real miracles occur. So I wrote this book at that time. All right, let's go into the caregiving profession specifically. So as a hypnotherapist, you can work full-time. It could just be your complete profession. Again, you don't need prior degrees or licensure, yet you'll be somewhat limited on what you can work on without a referral from a physician. It's wonderful to get referrals from physicians. I'm working with a gentleman now who has leukemia. And I said, yes, legally I can work with that. However, your physician will need to send a written referral that says, yes, it's safe to use hypnotherapy for this condition. We get those all the time. And doctors will refer to us without us even asking, these unsolicited referrals, because once they know, oh, this is an option, right, then we've had graduates who definitely, I know I do for sure, have doctors and psychiatrists who actually refer to us. Doctors quite often are looking for other solutions for their patients, but they just don't necessarily have the time to dedicate, like we do, 2 hours per client, right? A physician can see every 7 minutes another patient, right? They're not going to sit down for 2 hours, so they can refer to you as a hypnotherapist. You could also do the work part-time, right? A lot of our graduates only work 15 clients per week, which is 30 hours per week. It's not quite full-time, but you could just see 10 clients per week, and that's 20 hours per week. And you can really make a solid living. I won't go into the numbers tonight, but you can make some really nice money. doing this part-time. A lot of the mental health or any practitioner of the healing arts in any way will often use this as an adjunct. So massage therapy, right? You give a massage, but then maybe during that, you're offering positive suggestions and visualizations. Or if your client comes in and says, I'm really stressed and the massage is great, but it's psychological. I'm worried about something. You can sit down with them and apply hypnotherapy and neurolinguistic programming techniques and make that better, right? You're not just limited to your hands. You have a whole nother skill set available to you. So we'll talk about the other professions in the other slides and how this works as an adjunct for sure. We also, as I mentioned, work with referrals and / prescriptions. Under Florida hypnosis law, which is what we largely encourage people to abide by, no matter where you live, it says that if you're a hypnotherapist, or simply stated here, working on any type of medical, dental, or mental health condition, you need either a referral, prescription, or the next two words, supervision or direction. So if you're a physician, you can supervise and direct hypnotherapists. I worked for a while out of a psychiatrist's office, and he would just refer his patients to me, or I would sit in and listen in on his sessions, and then he and I would talk about, I'm like, okay, I see what you're doing. Here's what I would do. And honestly, I have to say, I think I was better. I had techniques. He had diagnosis and prescription. I have powerful techniques that can make that quite obsolete. I'll tell you a quick story. We had a physician going through our hypnotherapy training. He was standing during one of the entire lectures in the back of the room. And when I asked for a volunteer to work on a pain management technique, he volunteered. And when he sat down uncomfortably in front of the room, sitting down in the chair next to me, he explained he has really bad back pain. And that's why he had to stand. And I said, okay, from 1 to 10, 10 being the worst, how bad is the discomfort? He's like, that's like a 9. Then we started going into his emotions. And it turned out he was really angry at something. I said, from 1 to 10, how strong is the anger? It's like, well, it's like a 9. I said, okay, great. You ready to resolve that quickly? We didn't deal with the pain at all. We dealt with the anger. And as the anger reduced, the pain reduced. At the end of that demonstration, he went from a 10 down to a 1. Like absolutely no discomfort. Not only was the physical body free of discomfort, we had resolved the anger in a way that it won't come back anymore in that same way, because that issue was transformed for good. When that happened at the end of the session, he said, he's a physician, remember, he said, Matthew, I think you've just showed me that you've made my profession obsolete. Now, I'm not saying Western medicine is obsolete at all. I'm just quoting him, and I'm sure he wasn't totally serious. But I had shown him that after all the patients that he was seeing and treating on the physical level in a 20-minute demonstration, or however long it was, but it was brief, I showed him, if I heal your mind, I could heal your body, but both can be healed for good. Not that you can't get angry again, not that you can't have pain again, but if you eliminate a root cause and it's not there anymore, it'll never be a cause again, right? So if we're not working on those levels, we're missing something big time. Okay, there's also collaboration that can occur. Like I said, just sitting in a psychiatrist's office and working with his patients, talking out treatment protocols. But more than just that, I've been privy to be on different teams where they were building like electronic medical record systems and asking for my advice as a hypnotherapist. I've gone out to lunch with many physicians talking about just ways that we can integrate hypnotherapy into Western medicine. So anybody who's in our field can do that, or if you're in a caregiving profession that's not hypnotherapy, you can start collaborating with hypnotherapists. There's wonderful networking opportunities in these regards. Okay, so one major thing for those who are in the caregiving professions is to honor you might not be healed yourself, right? So the idea of physician heal thyself. So where is the place for hypnotherapy? Not just for your patients, but for you, right? If you sit there with a patient or client, we call our people clients, not patients. But if you sit there with a patient and you're feeling internally not whole yourself, right? You're spiritually disconnected. You're kind of atheistic in there. You're agnostic. I'm not saying you must believe in God, but I'm just saying like you're struggling, right? You don't really know what some deep truths are. You don't feel solid in your own path, or you have your own psychological disturbances. You're on medications to try to balance that, and you don't want to tell your patient, but you're not okay yourself. or you've got this deep hurt and sadness that you've been carrying for years and you're trying to help someone else. Our model in my book, The Sutras on Healing and Enlightenment, is very much about the healer, about the facilitator, because your state of wholeness lets you be a role model for others. It helps you to guide them towards health because you know how to get there because you've gotten there yourself, right? If you're not wealthy, don't teach people to be wealthy. If you're not whole, then what are we doing talking about wholeness with our clients? Most medicine, including psychiatry, psychology, is a movement away from pain, or more specifically, just treating the pain, right? Dealing with the illness, diagnosing the condition, and then prescribing usually for the condition or some type of treatment like surgery or whatnot. And again, sometimes that's really valuable. But if you're a hammer and what do you know except for hitting, right? If I give you a screw, but you're a hammer, you're not going to have a good relationship with that screw. You're not going to put it into the wood properly, right? There are other tools. And it doesn't mean that that hammer is useless, right? Thank God we have hammers. Thank God we have doctors and people who can do surgery. But the point of this slide is, what if that practitioner is not whole and healed themselves because their model has only been about healing illness? That's not the movement towards wholeness. So I've dedicated my life, after studying the great saints and sages of the world's religions, right, as a philosophy and religion major, I'm like, all right, who are the healed ones? Who are the ones who are doing incredibly well? Who are my role models going to be? And honestly, as my late teens, early 20s, I wasn't finding that in physicians or psychologists. I was finding that in the yogis and the Buddhists and these people who are glowing with light, who are like living on one meal a day because they're so full of love they barely need to eat. Or there's cases of what's called anedia or breatharianism, of these people supposedly and medically documented who don't need to eat at all, right? I studied a lot with Dr. Gabriel Cousens, and he talked about eating raw foods, live foods, to make the body a superconductor for divine energy. Right? He still is a brilliant physician based on a wholeness. So this is an invitation for anybody who's in the caregiving professions to consider hypnotherapy training, just because you can have profound personal and spiritual growth just by going through a hypnotherapy training. I've had a lot of doctors, dentists, acupuncturists, chiropractors, and we'll go through this list in a moment, who've gone through our school, who, I have a dentist, he calls me regularly. I got a call not too long ago. He's like, Matthew, I just love hearing your voice. I love going through the training, such great memories. He's like, I'm not using this training at all with my patients in dentistry, but I'm so glad I went through the training. And he just still thinks so highly of it to this day. It just makes you a better person, right? And if you are physically, mentally, emotionally healthy, right? You go into a doctor and the doctor's happy and they're laughing and they're friendly, right? You want to be with your patients when you're your best self. So the goal is to be a healed healer. It's an abstract concept. Nobody should really claim they're totally healed, but you do get to a point of realizing, hey, I'm like really good. I'm physically healthy. I'm an ideal body weight. I'm emotionally clear. I'm spiritually tapped in. I'm making good money. I'm doing my career. At some point you're like, wow, I figured out this game, right? I got this thing. You want to be that with your clients, even your patients, even if you're not doing hypnotherapy as a formal profession. Okay, next, let's talk about Western medicine, allopathic medicine, and mostly, our wonderful physicians and nurses. We've had a lot who have gone through our training. Nurses I have definitely seen have just left their occupation and have gone fully into hypnotherapy and actually make more money and in some ways feel a lot more rewarded. There's tremendous stress, obviously, in the medical field. Some people just aren't cut out for it. They don't want to have to do that for their whole life. They just didn't know of any other option at the time. So I'm not saying some people shouldn't really be doing that. Of course, we need that. But one way to consider it is maybe there's something else. However, let's say you're sticking with your profession as a doctor or a nurse. We can absolutely have doctors and nurses refer to hypnotherapists, so that's a big part of it. But when you start integrating some of these techniques into the practice, they're just basic language patterns. For instance, a doctor might say to a patient, "How is your pain?" As hypnotherapists, we understand when you say, "How is your pain?" then the subconscious, or the mind, has to check and say, well, how is pain? Right? Don't think of a pink elephant. So very simple language patterns can make the difference between how we effectively communicate. So if we just said something like, how is your level of comfort right now? Right? Then they're going to look for comfort, not for discomfort. Understanding powerful language patterns can be really instrumental in motivating proper behavior. If a physician is trying to get somebody to lose weight, right, then having a hypnotic programming recording available for a patient, which you can up the sale, right? I want to charge you for this recording. Your insurance is going to pay for it. We're going to bill you for this CD or whatever. And then the patient gets to go home and listen to your voice as the physician every day saying, you are now losing weight and feeling great. You are now eating healthy. You are now exercising regularly. These can be custom made for patients, and they can be generically made for a lot of patients. The benefit of hypnotic programming, however a patient gets that, can really only benefit them. If you're listening to a recording every day that tells you you're going to feel more comfortable, you're going to eat healthier, you're going to make the right food choices, you're going to exercise, you're going to sleep better at night, you're going to be more peaceful and calm and reduce stress, you're going to take your medications, right? How many people have been given really valuable medical advice, but they don't follow up on it because they just don't have the discipline to do so. Okay, so there are countless opportunities to integrate hypnotherapy. But then we get down to actual medical conditions. I can tell you I had a physician brought his patient right to my office. Literally, the doctor put the kid in the car, who was a 14-year-old young guy, and drove into my office. This young gentleman was vomiting uncontrollably, and there's nothing this physician could do to actually help. And he knew, because he knew the young boy now over a period of time, young man, he knew that this was psychosomatic. And he heard about my Healing the Mind, Healing the Body lectures. So he brings the kid to my office. We did some work in the office, but then I can remember getting a phone call from the physician later, I think that night, saying, we didn't quite get it. It's still really bad. I literally drove to the young man's house. He was in the bathtub. He was throwing up so much. That was like the only place that was good for him to be. Once I managed to settle down the nausea and the vomiting, when that stopped, I was able to get him over to one of the bedrooms in the house, and I was able to do some deeper work. It turned out he was violently angry with his father for whatever that was. But again, I was able to resolve the anger. I didn't really have to deal with the symptom, but through the power of the mind, I was able to get the vomiting to stop. I have seen from physicians referring to me ulcerative colitis completely healed. I've seen Crohn's disease completely healed. We have a documented case of Crohn's disease being completely healed within 10 hours of work. This woman came in. We did 10, 12 hours of work. She no longer has Crohn's. It is the most beautiful thing when a physician tells me, like, thank you, my patient is now healed of this. I have seen cancer of the blood. I think it was a form of leukemia. I never bothered to care about the exact diagnosis. I just wanted to do what I do, which is not a diagnostic model. We watched her blood work every week getting better and better. She was given 4 months left to live. And after 2 years, when I saw her and her friend again, they were thrilled to see me. Like, you saved her life. Like, she was dying of cancer, and because of this work, she's not. I can go on and on and on about these stories. So, however, when we work with physicians and nurses, or they refer to us, or they take on some of these skill sets, there is so much value to bring to the Western medical model. Let's talk about some of the other professions. Chinese medicine, again, that's my background. What I realized in Chinese medicine, there's a tremendous focus on qi, on energy, and there's actually a strong focus on the emotions and how they affect the flow of the qi. However, what I found in Chinese medicine is there really wasn't a modality that was directly dealing with the emotions. If you have anger affecting the liver and the other related organ systems, right, it's a complex form of medicine here. Like, what would you do with that anger in Chinese medicine? We could put an acupuncture needle or 2 needles in liver 3. There's a well-known, well-used Chinese medical acupoint. But how am I dealing with the anger, really? Right? There's something called the 4 gates to remove, to get stagnant liver qi, which is really suppressed anger usually, to get that to move. But nobody's teaching these clients how to not suppress their emotions, right? They feel anger come up, they don't like it, they close it back down, right? So people are blocking themselves all the time, right? Why do we need to open chakras? Why do we need to rebalance the energy body? Again, illness can come about from other sources, but when we're talking about psychosomatic, I just didn't see in Western medicine or in Chinese medicine or Eastern medicine, if you want to include the other countries that use this as well. In Eastern medicine, there really just weren't the modalities for this. What I had learned in the Yellow Emperor's Classic of Chinese Medicine was that they say the lesser physician heals on the body level. The mid-level physician heals on the energy level. The highest physician heals on the spirit-mind level. I'm like, oh, well, okay, what else is there, right? I'm going for the highest. Why would I'm young, I was, I'm in my 20s, I'm going to dedicate my life to the highest teachings I can access. And Chinese medicine was telling me I need to learn more about spirit and mind healing. There are a lot of things in Chinese medical college that made me realize, I think I want something deeper. For instance, when you put an acupuncture needle in, you could say if you turn it to the right, it tonifies the point. If you turn it to the left, it reduces the energy in the point. Sometimes there's too much chi, sometimes there's not enough. But other books would say, no, if you turn it to the right, it decreases, not increases. So the books contradict themselves. So I would ask my professors, well, which one is it? And they would say, it's not the needle. It's not the movement of the needle. It's your intention. I'm like, oh, it's the mind again. I see. Because then they would say, well, the Chinese medical needles, those are thick, but the Japanese needles are thinner. But then they get to the point where you don't actually have to put the needle on the body at all. And then, you just hover the needle above the point. So what is that all about? Well, it's like an antenna. It's like an energy transfer, which directs the healer's intention. I'm like, okay. This seems like mind again. I'm not saying there isn't energy, but what's directing the energy? Chinese medicine does say that mind directs the energy, right? So eventually, really great acupuncturists don't even use needles. They can just put their finger above. Not saying those who use needles are not great, right? But they'll talk about these very gifted healers who don't need to put a needle in at all because they'll just put their finger there. But then you hear about long distance healing where you don't even have to be in the same room because you can just send your chi to someone else. All right, what's going on here? There must be the power of mind going on. I read a book in Chinese medical college called Rooted in Spirit. And it said, when it was an acupuncture book, it said all healing must be rooted in spirit. Like, how am I rooted in spirit when I sit down with the patient and with Chinese medicine and I'm putting in needles, I'm doing my intake, I'm measuring pulse and looking at tongue and face color. And, there's complex, really amazing diagnostic systems, but I never felt like that was really rooted in spirit. Once I started doing more hypnotherapy during my acupuncture studies, here's a really powerful example of this. In the acupuncture clinic, somebody would come with shoulder pain, and we have all sorts of ways to treat that. Massage and acupuncture and even herbology to get that chi to move, right? Or different kind of ointments or whatnot. But you're still treating the symptom, even though you're dealing with the energy. Because I thought, all right, dealing with the energy is dealing with the root cause. But why is the energy out of balance? Once in a hypnotherapy training we were doing past life regression training, and we regressed a woman back to the root cause of her shoulder pain. In a quote, I'm not saying it's absolutely real, but in a quote, past life, she had a memory, or whatever the story is in the subconscious, memory, or somehow it's in there. This story came out of the subconscious, and it was of her being a warrior and having her arm cut off in a past life. Then that person dies, the soul continues on, reincarnates. At least that's the theory, right? Now, when we healed the memory of that, her shoulder pain went away. Because she was my classmate, I got to watch over and over again, like week after week, that she was reporting the shoulder pain is gone. It's probably one of those, like at graduation, she's like, I just want to say thank you, everybody. Like, this healed my shoulder pain. So at some point I became really convinced that the mind must be addressed, but it can't just be addressed through talk therapy, the cognitive behavioral therapy. That stuff all has its place, but it's not going as deep as we need it to go. What I found in hypnotherapy, which again is a profession that's really needed a lot more improvement, which I've been working to do, and other leaders have been working to do over the years. But once you catch on to the incredible power of the mind in relationship to healing the body, it's really hard to be true to yourself and true to others and ignore that, right? Like if I was just putting in an acupuncture needle in a shoulder, knowing that there's a mental emotional blockage in that region, if you will. I mean, is it stored exactly there? I don't know. But in the yogic psychology model, I was studying about what are called sanskars. A sanskar is a mental impression, it's a memory, and it usually for human beings has beliefs and emotions embedded in it. So, where the sanskar is stored, well, in an energetic medicine model, we would say in the aura, in the energy body, in the etheric body, or in the astral body. It's different words, but essentially we're saying there are blockages in the energy flow. Acupuncture needles don't address the psychological part of that blockage. And what's inside of that blockage? Unforgiveness, right? Somebody in there is angry. Someone feels guilty. Someone feels hurt. Someone hasn't let it go yet. What is forgiveness? It's really just a letting go, right? This energy is blocked. So if we're using only acupuncture needles, are we truly liberating a person, right? My path was about healing and enlightenment, like enlightenment. So are we offering the highest, deepest teachings to our clients, to our patients? All right. Someone said, welcome, thank you. Feel free to ask questions or chat with me. Is there any limit to what we can achieve if we work with the quantum model of reality, where we are causing an effect through the intention of our mind? With a trained mind, is there any limit? Well, obviously somebody's going to want to answer that and say, no, there's no limit. However, as professionals, we need to be realistic, right? Are there studies that show the efficacy of hypnosis? Absolutely. In case you're interested in that type of stuff, but you don't have access to college level medical studies, you can go to pubmed.gov. So it's a government website ending with a .gov, and just type in hypnosis for cancer, hypnosis for allergies. You will see abstracts, you'll see studies coming up that show the efficacy. So if there's no proof that it works, we do have to be careful on that. But what is the limit? I have to assess what is when a client comes to me and says, can you help me with this? I have to say, well, do I believe I can, right? Not just because I'm being optimistic, but is there any evidence? Like if your arm is cut off, like I work with a woman that's in our schools videos, phantom limb pain, really pretty easy to remove the phantom limb pain, but to grow her leg back, I never would promise that, right? So theoretically, could we grow the leg back? Well, has it ever been done before? Not really, right? So theoretically, sure, in the quantum field or the metaphysical quantum field, it's called the law of pure potentiality. You can manifest anything out of that law. But how many people have manifested unicorns? Without gluing one to the head or DNA modification, right? There is a limit, I believe, to how much we can do with our mind right now. 500,000 years from now, okay, maybe it's another story. But right now, I know I can't grow a limb back. Can I heal the blind? If it's psychosomatic illness, yes. If the eyes have actually been damaged so much, I was working with a client recently who doesn't even have I don't think there's actually an eyeball working or barely even there anymore in the left eye, and the right eye is almost completely blind because of severe damage. For me to say I could make that better would be unprofessional, I think would be unethical, and I'd be lying to myself because I don't believe I can do that. A lot of what we can do as hypnotherapists is help people to be at peace with the condition. We have a video in our school of a woman I'm helping with her diabetes. And I've talked to her recently about this. We didn't heal the diabetes, but we've changed her whole attitude around it. She's more at peace with it. She's doing what she needs to without resisting it. She loves herself more. The diabetes caused us to look at her negative emotions, right? She had sadness and fear and guilt. She had issues with her mother and her sisters, I remember. And through forgiveness work, we were able to bring her to so much more peace. So for me, healing is ideally resolving the symptom, right? But not always. Clearing any negative emotion so the heart is open and free and clear. Healing the mind, which can always occur, maybe severe mental illness, severe brain damage. But again, I'm honoring that there can be some limits. But we want to see physical, mental, emotional, spiritual healing. Spiritual meaning you're reconnected to love and joy and peace and bliss and oneness and divine wisdom. And you just feel inspired and reconnected. You have purpose, you have meaning. But also when we help people to be able to make more money, to have better relationships, to manifest a beautiful new home, right? Nobody's going to be, quote, perfect, right? It is a body, and bodies can still get sick from environmental toxins. I mean, every week or something, we inhale, we ingest, we digest like a credit card size of plastic. Like there's so much plastic in our food now, and that stuff causes problems. So we are dealing with environmental toxins now more than ever before. We're dealing with a lot of problems. And, if you get hit by a car and you break your leg, go to a doctor, don't come to me, right? So I would say, yes, there are limits theoretically. Okay, no, there aren't. But as professionals, we're going to have clients who come in and say, can you help with this? I had a client who had pancreatic cancer. She was 80 years old. And she heard one of my lectures. She's like, please, I don't want to die yet. I have so much more to live for. And I'm like, oh, God, what I've heard about that diagnosis is, that's a death sentence. You've got at that age, maybe 4 months left to live. I didn't say that, but I had to be honest and say, I would do my best. But at some point, probably early on, I said, at some point, if this isn't resolving, I can help you to pass away peacefully. After about a month or two of doing the work, when she couldn't even come into my office anymore and I was making house calls, I had to talk to her and her husband and say, I'm so honored that you want to work with me. I am touched beyond words that you want me in your home helping, your wife. So eventually they decided, all right, let's dedicate the work to just being at peace. So we healed her regrets. We healed her grief. We healed her guilt. We healed the sadness. I helped her with like a spiritual guidance level of working to help her to answer spiritual questions and recommend books. And I gave her my book, Peace Under All Circumstances. And she passed away peacefully. Her husband wrote me a beautiful letter explaining, how grateful they were for that work. And he actually signed a copy of his book that's still in our school's library. And I can always remember this woman's name. So to me, that's the stuff that's really touching. There's the fact that I get to interact with those kind of medical conditions and bring love and light and forgiveness to that equation. There's no limit to how much love and light and peace we can bring. Is there a limit to what we can do with the physical body? Absolutely, right? I can't grow an arm out of the center of your chest, right? There are just some things we can't. I can't grow an arm back. If you don't have eyeballs, turn to modern science for that one. But that's part of the answer to these limits. With the power of the mind, things can manifest in ways, I'll tell you another story, that you might not ever guess. I had a client who had peripheral neuropathy. Simply stated, he really had a lot of trouble walking, and it was obvious. We did everything we could with these modalities, and I showed him how to use the mind to manifest lots of other miracles in his life, and there are some really amazing stories there. But nothing I was doing was actually healing this issue. So I taught him and guided him through our creating and manifesting formula, which essentially is using the mind to pull something into your life, even though the mind can't do it directly, right? Like, I'm not going to grow your arm back, but maybe I can help you to manifest the money to get that prosthetic limb. In this case, he used that formula, and within 2 weeks, somebody walked into his place of business and said, sir, I'm sorry to ask you this. If it's personal, you don't have to answer whatever, but do you have peripheral neuropathy? And he's like, yes. And she said, well, I'm a NASA scientist. I helped to design the spacesuits for the NASA astronauts. And we actually found that because of the way it pressurizes the body and the way it makes blood flow in the legs, it's been used on peripheral neuropathy. And he started using it and noticed results. So the mind can be used indirectly to manifest the solution, right? So, Elon Musk and this Neuralink stuff and helping people to communicate who are totally paralyzed. I'm not necessarily going to get those people back to full functioning, but the power of the mind can be used to help them indirectly by manifesting great scientific techniques. All right, so awesome question. Thank you. So we talked a little bit about Chinese medicine. That's my background, so I can go on and on. But let's talk about mental health practitioners. We've absolutely had PsyDs, psychiatrists, psychologists, mental health counselors, social workers, and other related fields. But those are the big ones, right, who have gone through our training. So why? Why would they do this? The woman I helped heal of cancer that I mentioned, she was a psychologist, and the friend who referred her was a psychologist. And I asked them, I'm like, why are you coming to me? You're a psychologist. So we're not trained in what you're trained in. So I have a client now who's been a prospective client. She's trying to become a client, but I think I decided not to work with her. But um, she was asking about a certain psychologist she could work with. And I said, honestly, they're probably not trained in the same techniques that I am. It's not putting down a profession. It's just saying that doctors aren't trained in the techniques I am. They have their own specialized form of training, and people specialize, right? So just because someone has a licensed mental health degree, it doesn't mean they actually know certain principles or techniques. I was working once personally with a client of mine. We did an exchange. She was a social worker, and I was dealing with my own personal issue at the time, and I went to her office. She came to my office. I went to her office. It was like very professional, and when she was in my office, I helped her. Then I went to her office, and I told her my issue, and we talked and kept talking and kept talking. And eventually I said, what are we going to do to resolve this? And she said, well, we just talk. We work to get a handle on it. We just help you to understand it better. I said, if you came to my office, I would do this, I would do this, I would do this, I would do this. I would do hypnotic programming. I do eye movement therapy. I do parts therapy. I do regression therapy. I would do breath work. If none of that was working, I would do past life regression therapy. If that wasn't working, I'd do idiomotor questioning. I mean, I'm just listing some stuff now, but this is probably the stuff I said back then. And she said, well, actually, we moved on. She's like, well, okay, I'm not trained. She said, I'm not trained in that kind of stuff, so let's just keep talking. After about 10 minutes, I'm like, I said, what are we going to do to resolve my problem? I said, if you were in my office, I would do this, I would do this, I would do this. She said, Matthew, it hurt the first time when you said it. I'm like, I'm sorry. Like, I didn't mean to hurt you. I'm just really asking for help, and you don't have the techniques to help me. So this is an invitation to anybody who's in the licensed mental health profession to do a real in-depth soul search and say, when you sit there with a patient, do you really feel empowered to help them, or are you just talking? Right? If it's only talk therapy, that's what our graduates are trained in just the fundamentals level of rapport building skills and listening skills. A good listener should be your friend, right? Not your professional therapist, or you're paying $300 for a session, right? Or insurance is paying for it. But if insurance pays for it, when you get to go in every week and talk to your therapist, well, you have a friend, someone who will listen to you. But hypnotherapy, we're not a diagnostic profession. We don't take insurance. People pay us directly. And studies have shown people get better faster if insurance is not paying for it, right? So there's something called a secondary gain, or a negative payoff. You get something out of having your problem. If we keep going to a therapist because this person will just, listen to us, and, like the only person who really listens, and you might feel better when you walk away. But you shouldn't have to keep going back again and again and again and just talking about life's challenges with someone who will listen well. Hypnotherapy offers practical techniques that make us obsolete in the lives of our clients. That's what my mentor, Gil Boyne, taught me. Make yourself obsolete in the lives of your clients by actually using techniques that transform the issue. So if you're sitting there as a mental health practitioner feeling like, I don't actually know how to resolve this issue, I can just do listening skills, it's just not enough, right? And sometimes what we're trained in Western psychology, it's like cognitive behavioral therapy. Some studies that we've quoted in the field of hypnotherapy have shown that it's not as effective actually as hypnotherapy, because if you're working more on the behavioral level, you're not necessarily working in the subconscious level, right? Therapists know there's a subconscious mind, but how much training do they have to actually access it? We need an altered state to access the subconscious mind. So we have hypnosis, we have breath work. Those are like the main ways that you get in there, hypnosis and the power of the breath through things like rebirthing or holotropic breath work. We also have, like in the psychology fields, I practice EMDR. We in neurolinguistic programming and in hypnosis, we've been with hypnosis moving the eyes back and forth for a few hundred years now, right? We started that. We said, follow my fingers, follow the pendulum. So why are the eyes going back and forth beneficial? Simply stated, it gains access to the subconscious. So if a therapist is not trained in EMDR, or in our field where we don't claim to do that, but we have something that kind of looks like it, it's just not EMDR, we just call it EMT, eye movement therapy. And again, we don't treat therapeutic conditions outside the scope of our training. So it's important to see these are different professions and different techniques. However, there are similarities. When you find that way to access the subconscious mind, then you need this specialized training about how to get good information in there and how to get the negativity that's out in there out and to transform it, essentially. Meaning, if there are deep-seated memories and emotions that aren't resolved, just talking about that doesn't quite do it. And just trying to change behaviors doesn't quite do it. We need to have direct intervention at the root cause level. And again, some therapists are trained in that, but others aren't. Also, as a hypnotherapist, you can work in coordination like a social worker. They might go to someone's house and do a assessment and see, okay, this child needs help. But usually it's good the parent needs help, right? And what can the social worker do? Maybe they're not trained in any technique to actually sit down one-on-one and to transform that parent. But with hypnotherapy skills, you absolutely could, right? When we work with children in hypnotherapy, a lot of our graduates now understand you need to insist that the parents get hypnotherapy as well. Okay, so I can obviously go on and on about this slide as well, but just consider for a licensed practitioner, a licensed mental health practitioner, being a healed healer yourself, so going through a hypnotherapy training like ours, really profound personal and spiritual growth, and again, techniques that can really help others. Or as hypnotherapists working in coordination with these practitioners, right? If you get a client who calls and says, I have PTSD, you say, well, that's a it's a psychological condition that's been diagnosed. So as a hypnotherapist, I need to get a referral from the diagnosing or the treating therapist. So it might be a licensed mental health counselor who doesn't have hypnotherapy training who says, yeah, I'm willing to send my patient over to that hypnotherapist to see how that could work, right? So again, we as hypnotherapists can have great relationships with mental health counselors. And if you're a mental health counselor, you go through this training, but you're like, yeah, but I'm not going to do hypnotherapy. At least you'll appreciate it more and then refer patients when you feel like somebody else, like a hypnotherapist, could help. All right, either way, the techniques are very powerful in mental health, obviously. Chiropractic, let's spend a moment with that. When you go to a chiropractor, right, they tend to just crack your back. They do more, but it's like we know them for cranking your neck and cracking your back. The theory, and I'm not qualified to really talk about it, it's not my field, is that the nervous system is not able to do its job properly when the spine is misaligned. And they've really concluded getting the spine aligned, right, is a major key to health. Okay, great. So that's simple. But now they realize that there's muscle tension causing the spine to get out of whack. Okay, so what do chiropractors often do? They bring in massage therapists because the chiropractic adjustments last longer if you massage those muscles and soften them. If you massage the muscles first, the adjustments are easier to make, right, and they're going to last longer. But the spine comes out of whack again. Why? Because the muscles got tight again. So what do massage therapists catch on to after being in the field for months or years? When you're massaging those muscles, clients tend to end up crying, right? We realize that inside of those muscles, there's stored emotion. This is what I realized in Chinese medicine. Inside these energy blocks that we're talking about, there's stored emotion. So what does the massage therapist usually do in their progression as a healer? They go and learn energy medicine, right? They learn reiki or therapeutic touch or acupuncture, because they realize, like chiropractic, spine's out of whack. Why? In some cases, because there's muscle tension pulling on the spine. Okay, well, what's in the muscle tension? Emotion, or you could just say a blockage of energy. So if you're going to put an acupuncture needle there, you might actually free up the energy and the muscle and the alignment longer because you're dealing with it on the energetic level, not just the physical or emotional level. But now, when you start getting into, well, what is this energy? Massage therapists usually catch on at some point. The energy that's causing that muscle to be tight is fear. What is fear? That's mental, right? Fear is an emotion that arises from thoughts. Your thoughts create your emotions. Your unresolved emotions create energy blockages, create tension, and can pull your spine out of whack. So we've had chiropractors go through this training and saw the tremendous benefit. Just like with acupuncture, you take the chiropractic and the acupuncture, but underneath it, you understand there's a whole level called mind. And if you forget about the thing called mind, if you think it's only the brain and brain chemistry, like, oh, you just have a lack of dopamine or a lack of serotonin, Most doctors don't know that anyway, honestly. You go into the doctor's office, you say you're depressed, they say you have a chemical imbalance, but nobody actually measured what was in your brain. They gave you a medication. The medication makes you feel better, and they conclude, therefore, oh, you must have had a chemical imbalance because this medication made you feel better. Maybe it was placebo effect. Maybe they've been really stressed and finally someone listened to them, gave them medication, right? We know a lot of medicine is placebo effect, meaning it was the fact that you believe you have a medication that's going to help you, that's actually what helps you. They've actually shown that surgery can be influenced by the placebo effect, meaning somebody has knee pain and they go in for surgery, but somebody also is told, go in for the surgery, but they don't actually get the surgery. They actually have done studies on this. And just the fact that you believe you had surgery on your knee pain, there's enough power in the mind to make that pain go away, even though you never actually had surgery. I don't know exactly how they did that study, but that is a real study. So it's great. Chiropractic, awesome. Thank God we have chiropractors. Right? If you get a car accident, let them adjust you. But if you're dealing with pain or misalignments that are psychosomatic in origin, then complementary, or as an integrated medical approach, get a hypnotherapist working on the mind. Right? If you're going to be a chiropractor and bring in a massage therapist to loosen up the muscle tension, bring in a hypnotherapist who can loosen up the mental tension, which is causing the muscular tension. So again, it's just working at root cause. Next, dentistry. Like I said, we've had dentists who have gone through this training. We can use hypnosis in dentistry for pain management, for reducing anxiety, for reducing salivation, for controlling bleeding. We can have complete anesthesia, or analgesia is probably the more accurate term. I've seen root canals performed with absolutely no chemical anesthesia whatsoever, or chemical analgesia. Gagging reflex. I had a gentleman who the dentist referred him because he couldn't wear his dentures, and that was affecting him socially. His wife was a supporter of the work, so they both, husband and wife, came into my office, and I was teaching this gentleman, your gag reflex is not because of your dentures. Your body doesn't do that. That is psychological. So we did some work, the kind of work that we do in hypnotherapy and NLP. And just without even formal hypnosis, I got him to be able to sit there wearing the dentures without gagging. Like it was at a 10 where he couldn't even put it in his mouth. And then after about a half hour, I got him down to a 1 where he was able to wear it. Then I was able to get him actually in my recliner into hypnosis and program in, now you comfortably wear these. Now you're in control. But I kept saying to him, nothing outside of you has power over you. The dentures do not have power to make you gag. Nothing outside of you has power over you. The wife heard that over and over again during the session. And she told me the next day, or not long after, she said, I want to thank you. He's so much happier. He can smile now. He goes out and we socialize. You did it in one session. Thank you so much. She said, and I stopped smoking during that session because she was in the room. And I said, but we didn't work on you. We didn't work on you to stop smoking. She said, I know. I just kept hearing you tell him over and over again, nothing outside of you has power over you. And she stopped smoking, realizing cigarettes can't make you smoke cigarettes. So dentistry, you might not stop seeing patients, but you can absolutely have a hypnotherapist kind of on hand who can help to get people to have proper dental habits, right? What about a hypnotic programming recording that patients use to say, brush your teeth, floss every day, right? Floss only the teeth you want to keep. I saw that once on a dental billboard. Floss only the teeth you want to keep. We know people should be brushing and flossing, but how does the dentist get them to do that? Give them a toothbrush and some floss before they leave, right? What if you gave them a recording that actually encouraged them to have proper dental habits? Are they going to use it? I don't know, but it's an option. I've done lunch and learns where I go into dental offices during their lunch break, give them pizza, and talk about the applications of hypnosis in dentistry. The nice thing about that is the dental staff tends to become your client, but they also start referring people to you. Right? People do deal with dental pain, and just being on chemical medication that'll make that better is not always the healthiest thing to do. So if a dentist understands, you can refer to a hypnotherapist who could help to alleviate the pain. Or if somebody can't use chemoanesthesia or analgesia for the dental procedure, we could actually teach the patient to numb their entire jaw. Right? You can do what's called glove anesthesia and transfer that. But this glove anesthesia where we make the hand numb, and then transfer to the jaw is completely psychological. That is totally in the mind, right? It's not your hand doing anything. It's just we utilize the hand for glove anesthesia by transferring that to different parts of the body. So there are about 20 or so, at least 12, I want to be accurate, but at least 12 major pain, no, it's closer to 20, major pain management techniques that we teach in our school here, and they can all be applied to dentistry. So there's pain, but there's also all sorts of other challenges. Bruxism, grinding your teeth, totally psychological, right? But what does a dentist do? Well, they'll give you a mouth guard. Well, what if we put two imaginary balloons in the back, like the little red clown nose balls, in the back of your jaw, and just expand those open, encourage this area to relax, right? That's just one example of a little mental technique to keep you from grinding your teeth. That's a lot less than having to wear a mouth guard every night. Okay, so it's a little bit about dentistry. Hypnotherapy and other professions before we start to wrap it up. A lot of people who go through our training are Reiki practitioners or Reiki masters. In Reiki, I have second degree Reiki during my acupuncture studies. I was like, oh, yeah, got to get that, right? And it's pretty, quick and easy to learn levels 1 and 2. In level 2, you learn about a certain mantra and symbol that you're not supposed to share with others. That there's like 3 of those in level 2. That deals with a psychological transfer. So like while your hands are on somebody, sending them healing energy or channeling healing energy. You also can do this certain mantra that gets you to connect with their minds. You could actually send positive thoughts. Okay, great. Let's assume that happens. But Reiki is limited, right? Yeah, you're doing something balancing the energy, but why is the energy out of balance in the first place? Reiki acknowledges the need for a psychological transfer of positive thinking. But what's going on inside of this person, right? When you get really intuitive like that, while I was doing those studies, I was also studying with a psychic medical intuitive, and he was so gifted. He was teaching me a lot of what he was doing, and I was getting really good at knowing what was going on inside of a client, to feel what was going on in their body, to actually know, like, oh, this is physically, mentally, emotionally, what's happening in that person. The more you attune to that, it's great. But if you don't have the skill sets to transform what's inside of them, then in Reiki, you're essentially, at least what I know about up to level 2, is you're sending positive energy and you are sending positive thoughts. That's, again, I'll admit my lack of training in Reiki. I would say that's kindergarten level healing, right? Knowing that you could put your hands on someone and heal them, that's super basic, right? You don't really even need Reiki attunements for that to occur. And then, of course, you can send positive thoughts to somebody. So if you realize that you need to affect their energy body and their psychological body, their mental body, their mind, then you need to be able to get in there with more in-depth technique. Life coaches. Life coaching is awesome, right? A lot of people get into that first and then realize, if I had hypnotherapy and NLP training, I would be a far more effective coach. Because while you're encouraging someone to live their very best life and be successful in all aspects of their life, and they learn how to set goals, and you learn about clearing some blockages, once you realize the blocks to success are mental, then you need the techniques to clear those mental blocks. But the mental blocks are largely subconscious. And again, without ways of accessing the subconscious mind, which life coaches aren't trained in, then you're not necessarily getting to the root cause of the problem that's keeping them from succeeding anyway. So in life coaching, if you were able to put your client into hypnosis, you could at least program in that they're reaching their goals. But with hypnotherapy, you could actually clear the blocks that keep them from succeeding. In emotional intelligence, EI practitioners clearly know that emotional intelligence can get better. While IQ, you're kind of locked in with that. Kind of like if you're dumb, you're dumb. And if you're brilliant, you're brilliant. That doesn't change much according to those studies. But in EQ, you can improve emotional intelligence, and that's a wonderful thing in the workplace, in university settings, in any application. Being more emotionally intelligent can be more valuable in many ways than IQ. But how do you really raise that? Well, EI practitioners have techniques, but they're not necessarily hypnotherapy techniques. We work with a graduate, Dr. Hank Clemens, who's written books, and he's like a major player in the EI field. And he went through our training, right? Because there's only so much knowledge in that field. but there's a lot of knowledge in our field. When you bring them together, you have this complementary way of working. And it's very practical for people who are Reiki or life coaches or EI practitioners, because you don't necessarily have very high credentials, right? What is a Reiki practitioner? You can say you're a Reiki master, but you don't really have any major credentials unless you do from something else. When you're a clinical certified clinical hypnotherapist with state licensed diplomas, you actually do have real state licensed diplomas, right, in an occupation. Personal trainers, I've worked in coordination with them, and we definitely have them go through our training. In fact, one of our main instructors is a yoga teacher and personal trainer utilizing hypnotherapy, because you want to get your clients to eat better, but they're not, right? You want to get them to do the exercise routine, but they're not. A simple hypnotic programming recording coming from your personal trainer can be very powerful, or the personal trainer refers. So I would refer my weight loss clients to my personal trainer. This one gentleman in particular at one time, and then he would refer his people to me, not just for the pain, for the weight loss type of stuff. When people have pain and they can't exercise, he brought in a client of his into my office who had really severe pain. And within a very short period of time, we had that, like in that very session, we had that resolved, right? So if you know you can use only the mind, like I can do this without touching you, without doing acupuncture needles, without prescribing medicine, without putting my hands on you. If I can just talk to you and make your pain go away, right? We're using hypnosis, but I don't have to touch you to do that. I don't have to send energy to you to do that. Then what does it all come down to? Mind, right? How are they going to lose weight? Mind. Right? It's not working out that makes you lose weight, because you have to have your mind in the right place to go work out in the first place. If you don't love yourself, why are you going to go work out? Yoga and meditation teachers. Yoga is beautiful. I've been practicing it my whole adult life. But it obviously just doesn't have a lot of these techniques. I've lived at ashrams. I lived in India, at an ashram in India as well, plus some in the States. And I can say there's a lot of yogis who, while they're wonderfully spiritually realized, they still have a lot of the same emotional blocks that everybody else does. Because the path of yoga and meditation doesn't always get to the deep subconscious blocks. So if you're a meditation teacher and you've been learning about like teaching relaxation, teaching breathing, you're eventually going to realize you have a limitation. Like mindfulness meditation teachers, there's only so much you can practice being mindful while your heart is still deeply wounded from childhood traumatic memories, right? And hypnotherapy has the skill sets to get into that subconscious mind to heal the stuff that's below conscious awareness. There's only so much you could do through willpower. There's only so much you can do by sitting there trying to focus your mind in a meditative, mindful way, especially when your heart is deeply disturbed. Your heart is the root of your mind. Whatever this feels, this is going to talk about. And if this is deeply disturbed, this thing won't shut up. Your mind is a problem-solving computer. It's going to constantly try to find a way to make this feel better. It'll turn to drugs and alcohol and everything you can do to make that feel better. So there's only so much we can do with yoga and meditation, as wonderful as those paths are. I mean, I got a meditation cushion, yoga mat right behind me. I'm a huge believer in that, but I do see the limitation of it for sure. And combining hypnotherapy with it makes you much more effective in helping others. Plus, if you're guiding people in yoga or meditation, knowing really advanced language patterns, like, because I'm a yoga teacher, I don't teach anymore, but I used to teach yoga for years, and I am a meditation teacher now. I'm far better at that because of my hypnotherapy and neurolinguistic programming training for sure. And the nutritionalist, same thing, right? You can know how to get somebody to eat, lead a horse to water, but can't make them drink. So what if a nutritionalist was programming clients? Here's a hypnotic programming recording. Go home and listen to this every day. It's going to program you to either generally eat better or specifically, right? You can make a customized recording for a client and say, for breakfast, this is what you eat, right? This is how much you want to drink per day. Enough repetition in a recording will influence the subconscious mind. But again, coordinated referrals. So if you're a hypnotherapist, refer to a nutritionist, because while we're telling somebody it's important to eat healthy, you need to, as a hypnotherapist, understand most people don't know what that is. Like, eating healthy is not to take out the middle piece of bread in your Big Mac. I heard that once. Eating healthy is not cutting back every morning in your fried egg and cheese sandwiches, like not having 3, but having 2. People really just don't know. right? Going the Diet Coke doesn't mean you're eating healthier. So trust me, after so many years of experience in hypnotherapy, Americans don't know how to eat healthy despite what they say. So if you're a hypnotherapist and you ask, okay, you want to lose weight? Well, what do you eat for breakfast? What do you eat for lunch? We're not, as hypnotherapists, legally allowed to offer nutritional advice, but I would definitely ask my clients, because also my background in Chinese medicine, which has a lot of nutritional studies, I would just say, like, what is your breakfast? What is your lunch? What is your dinner? And I'm usually appalled. I'm like, really? That's what you eat? Like, Doritos are not a staple. So if you had training in nutrition and hypnotherapy, you would be really empowered to help someone in that way. Okay, I believe that takes us through the presentation. Just so you know, and then I'll open it to Q&A if there is any, but feel free to use the chat pod now if you have any questions or comments. Our next training begins June 29th, so it's coming up in 9 days. We still have seats online and in Orlando right now. And yeah, if this was interesting to you, I would love to take you through the training. We have a lot of people in this current summer enrollment who are in these kind of fields. So I hope you enjoyed the presentation. If you're starting our class on June 29th, I know a lot of people have enrolled who are like social workers, massage therapists, Reiki practitioners. But again, you can do this training whether you have mental health, whether you have any degrees in caregiving professions or not. About 50% have gone through this training, have that, and 50% don't. We've had truck drivers and chefs, and like you name it. Every profession can go through, any person can go through this training. But if you're in the caregiving professions, really, you most likely can help people so much more when you're empowered with hypnotherapy and neurolinguistic programming skills. All right, thank you everybody for being here. Any questions or sharing before I close it down for the night? All right, very good. Next week, we'll be talking about anxiety and depression in relation to hypnosis, more hypnotherapy, more about that layer where we close down. And then tomorrow night on a hot meditation system support group at onlinemonastery.com. Very good. Thank you, everybody who's been here. I'm not going to say names, but thank you. And it's the best training. Trust me, it changed my life. Awesome. Thank you as well. Okay, great. Thanks, everyone. Have a good night. And I'll see you next week or maybe tomorrow night at onlinemonastery.com. Great. Thank you.